Dear respected guests, colleagues, and everyone joining us today, a very warm welcome to today's public lecture. This is Words of Inspiration. Today's session is Periods in Islam, Pain, PMS and Worship, according to the Quran, citing Surat al-Baqarah, chapter 2, verse 222. Today's discussion is guided and framed by authentic Islamic sources, alongside relevant medical and educational evidence, as mentioned in the Quran, Surat al-Baqarah, chapter 2, verse 222. According to Islamic teachings and the National Health Service (NHS), citing guidance on menstruation and menstrual health, we will explain the key Islamic concepts of haid, menstruation, tuhur, the state of purity, salah, prayer, and ghusl, ritual purification, alongside a clear medical understanding of menstruation and period pain. As mentioned in National Health Service, NHS 2023, period pain, overview. What does Islam say about menstruation? An academic overview. Allah says regarding menstruation in the Quran, Surat al-Baqarah, chapter 2, verse 222, وَيَسْأَلُونَكَ عَنِ الْمَحِدِ قُلْ هُوَ أَذًى فَاعْتَزِلُوا النِّسَاءَ فَاءَ الْمَحِدِ وَلَا تَقْرَبُهُنَّ حَتَّى يَثُرْنَ فَإِذَا تَطَهَّرْنَ فَأْتُوهُنَّ مِنْ حَيْثُ أَمَرَكُمُ اللَّهُ إِنَّ اللَّهَ يُحِبُّ التَّوَّابِينَ وَيُحِبُّ الْمُتَطَهِّرِينَ. Translated as, they ask you about menstruation. Say, it is a state of harm, so abstain from sexual intercourse with women during menstruation, and do not approach them until they are purified. When they have purified themselves, then approach them in the manner Allah has commanded you. Indeed, Allah loves those who constantly repent and loves those who purify themselves. According to the Quran, citing Surat al-Baqarah, chapter 2, verse 222, Allah describes menstruation using the Arabic word adha, meaning harm, discomfort, or something troublesome. The verse instructs married couples to abstain from sexual intercourse during menstruation until purification, establishing clear boundaries while emphasizing care, respect, and consideration within married life, as mentioned in the Quran, Surat al-Baqarah, chapter 2, verse 222. Islam does not teach that a menstruating woman herself is dirty, sinful, or spiritually worthless. Her dignity and accountability before Allah remain intact. According to Sahih Muslim, citing the narration of Aisha, may Allah be pleased with her, the Prophet, peace and blessings be upon him, continued to show love, affection, and closeness towards his wives during menstruation, while observing the limits set by Allah, as mentioned by Muslim ibn al-Hajjaj in Sahih Muslim, Hadith 293. Worship during menstruation, key rulings. During Haid, a Muslim woman does not perform the 5 daily salah and does not fast in those days. When menstruation ends, she performs ghusl and resumes salah. Missed Ramadan fasts are made up later as required. According to Sahih Muslim, citing the narration of Aisha, may Allah be pleased with her, women during the time of the Prophet, peace and blessings be upon him, were instructed to make up the obligatory fasts they missed because of menstruation, but they were not required to make up the missed prayers, establishing this important Islamic ruling, as mentioned by Muslim ibn al-Hajjaj in Sahih Muslim, Hadith 335. Detailed matters, minimum and maximum duration of haid, distinguishing istihada from tuhur, spotting, and signs of purity, should be learned within a recognized madhab, as rulings differ in some details. Hanafi, Shafi'i, Maliki, Hanbali. Standard references include Ibn Abidan, Rad al-Muhtar, al-Nawawi, al-Majmu', Khalal, Mukhtasar Khalal, Ibn Qudama, al-Mughna. Preparing a girl for her first period means giving her clear, calm, age-appropriate information in a supportive and shame-free way, so she understands that menstruation is a natural part of growing up, and feels prepared, confident, and comfortable asking questions. Teach before menarche, the first menstrual period, using simple, age-appropriate language. UNESCO advises early, stigma-free puberty education. According to UNESCO, citing international guidance on age-appropriate education, best practice is to provide information early, at an age-appropriate level, and in a respectful, shame-free way, helping young people develop accurate knowledge, confidence, and healthy attitudes as they grow, as mentioned in UNESCO, 2014. According to the NHS and the World Health Organization, WHO, citing guidance on puberty and adolescent development, a girl's first menstrual period, known as menarche, typically begins at around 12 years of age, although the exact age naturally varies from person to person, as mentioned in NHS guidance, 2023, and WHO guidance, 2020. She should know, in simple steps, According to the Royal College of Obstetricians and Gynecologists, RCOG, citing guidance on menstrual health, girls and women should be taught what menstrual blood may normally look like, including changes in color, consistency, and flow, and how to use sanitary pads or other suitable menstrual products safely, hygienically, and confidently, as mentioned in RCOG, 2021. According to the Royal College of Obstetricians and Gynecologists, RCOG, citing guidance on menstrual health and hygiene, good menstrual hygiene includes bathing regularly, changing menstrual products every few hours or whenever needed, and disposing of single-use products or cleaning reusable products safely and hygienically, as mentioned in RCOG, 2021. According to the National Health Service, NHS, citing medical guidance on periods and menstrual health, common symptoms during menstruation can include tummy cramps, lower back pain, tiredness, and mild changes in mood. For many people, these symptoms are temporary and manageable, although severe pain or symptoms that significantly interfere with everyday life should be discussed with a healthcare professional, as mentioned in NHS guidance on periods and period pain. According to the Quran and authentic Hadith, citing Surat al-Baqarah, chapter 2, verse 222, and the authentic narrations concerning menstruation, during Haid, menstruation, a woman pauses salah, obligatory prayer, and fasting. Once the menstrual bleeding has ended, she performs ghusl, ritual purification, and resumes her acts of worship. Missed obligatory fasts must be made up, whereas missed prayers do not need to be made up, as mentioned in the Quran, Surat al-Baqarah, 2:22, and Muslim ibn al-Hajjaj in Sahih Muslim, Hadith 335. For more detailed rulings or individual circumstances, seek guidance from a qualified Muslim scholar. According to the Quran and authentic Hadith, citing the Islamic rulings concerning Haid, menstruation, a woman pauses salah, prayer, and fasting during menstruation. Once the menstrual bleeding has ended, she performs ghusl, ritual purification, and resumes her acts of worship. Missed obligatory fasts are made up, while missed prayers are not, as mentioned in Muslim ibn al-Hajjaj, Sahih Muslim, Hadith 335. For detailed rulings or individual circumstances, guidance should be sought from a qualified Muslim scholar. According to the National Health Service, NHS, citing guidance on menstrual health, keeping track of the start and end dates of each period, along with symptoms, using a diary, calendar, or suitable app, can help a woman understand her menstrual pattern and identify changes. This record can also be helpful when seeking medical advice or asking Islamic fiqh questions about Haid and Tur, as supported by NHS guidance on tracking periods and menstrual symptoms. According to UNESCO, citing guidance on education, confidence, and supportive learning, young people should never feel ashamed or embarrassed to ask questions or seek help from a trusted parent, teacher, healthcare professional, or, for matters of Islamic faith and practice, a qualified Muslim scholar. Having access to trustworthy information and supportive adults can help build knowledge, confidence, and a healthy understanding of growing up, as mentioned in UNESCO guidance on education and young people's development. Menstruation is not frightening or shameful. It is a normal biological process created by Allah, and with knowledge and kindness, girls are prepared. Why do periods hurt? According to the American College of Obstetricians and Gynecologists, ACOG, citing medical guidance on menstrual health, dysmenorrhea is the medical term for painful periods, particularly the cramping and pain associated with menstruation, as mentioned in ACOG 2022. According to Yacovides et al. And the American College of Obstetricians and Gynecologists, ACOG, citing research and clinical guidance on primary dysmenorrhea, chemicals called prostaglandins cause the muscles of the uterus to contract rhythmically to help shed its lining. These contractions can temporarily reduce blood flow to the uterine muscle, contributing to the cramp-like pain experienced during menstruation, as mentioned in Yacovides et al. 2015 and ACOG 2022. Higher prostaglandin activity means stronger contractions and often more pain. Harrell, 2006. Common symptoms include lower abdominal cramps, low back or thigh pain, nausea or vomiting, diarrhea, headache, and dizziness. ACOG 2022. ACOG distinguishes primary dysmenorrhea, pain without another pelvic disease, from secondary dysmenorrhea, where conditions like endometriosis or fibroids cause pain. ACOG 2022, Yacovides et al. 2015. Why do some women suffer much more than others? Women should not simply be told, period pain is normal, just tolerate it. Severe or changing pain deserves attention. Mild to moderate cramping is common, but severe, disabling, or progressively worsening pain deserves evaluation. Possible causes include endometriosis. Tissue similar to the uterine lining grows outside the uterus, often causes severe cyclical pain. NICE 2017. Update 2023. Adenomyosis. Endometrial-type tissue grows into the uterine muscle, can cause heavy, painful periods. ACOG 2021. Fibroids, non-cancerous growths, may lead to heavy bleeding, pressure, and pain. NICE 2018. Pelvic inflammatory disease, an infection of the reproductive organs, requires prompt treatment. CDC 2021. Other anatomical, hormonal, or gynecological conditions can also contribute. Assessment can identify treatable causes. Seek medical evaluation if pain prevents normal activities, causes absence from school or work, suddenly worsens, starts later in life, does not improve with painkillers, occurs with fever, foul discharge or vomiting, is associated with pain during sex or bleeding between periods, or leads to fainting or severe dizziness. NHS guidance. See a GP for severe or worsening period pain and urgently for red flags. NHS 2023. Natural and traditional ways of reducing period pain. There are several reasonable supportive approaches. Heat. A hot water bottle or low-level heating pad on the lower abdomen can relax uterine muscle and ease cramps. A warm bath may also help when used safely. Exercise. Gentle walking, stretching, and regular moderate activity can reduce symptoms for some women and improve overall well-being. Sleep and stress. Poor sleep and high stress can amplify both physical pain and mood symptoms. Aim for consistent sleep and simple stress reduction routines. Ginger. Clinical reviews suggest ginger can reduce menstrual pain for some, though preparations and study quality vary, so use thoughtfully and discuss if unsure. Remember, herbal does not automatically mean safe. Some herbs interact with medicines, affect bleeding, or are unsuitable in pregnancy or certain conditions. Seek medical advice. These approaches are complementary supports, not cures, and should sit alongside appropriate medical care when needed. Pharmaceutical treatments, NSAIDs, like ibuprofen, are evidence-based for menstrual cramps. They lower prostaglandin activity, easing uterine contractions and pain. Use only with medical guidance. NSAIDs, such as ibuprofen, target a key mechanism in dysmenorrhea by reducing prostaglandin-mediated cramping, one of the most established options for period pain relief. ACOG notes, ibuprofen can work best when started at the onset of cramps, and for predictable cycles, sometimes just before symptoms, if advised by a clinician. NSAIDs are not suitable for everyone, especially some people with stomach ulcers, kidney disease, certain asthma sensitivities, or other conditions. Seek medical advice. Paracetamol can help some people, though NSAIDs often target cramping more directly. Always follow local medical guidance and product instructions. For persistent dysmenorrhea, or when endometriosis is suspected, doctors may consider hormonal options, such as certain combined or progestin-only pills, or a hormonal IUS, tailored to the patient. Why do some women become very emotional before their periods? This needs careful explanation. Dismissing someone as moody because of her period is neither medically accurate nor respectful. During the menstrual cycle, estrogen and progesterone naturally rise and fall. In some women, the brain is more sensitive to these normal shifts, which can affect neurotransmitters that help regulate mood. This can contribute to premenstrual syndrome, PMS. Symptoms can include irritability, anger, crying, anxiety, low mood, trouble concentrating, food cravings, sleep disturbance, breast tenderness, and bloating. ACOG notes that irritability and angry outbursts can occur, but there is an important distinction. Just before menstruation, falling estrogen and progesterone shift brain signaling, setting the stage for mood changes. Estrogen usually supports serotonin, boosting its signaling, so the premenstrual drop can reduce resilience against low mood or irritability. Progesterone converts to allopregnanolone, a neurosteroid that typically enhances GABA-A activity, promoting calm and sleep. In susceptible women, GABA-A receptor sensitivity can change in the luteal phase, so allopregnanolone can paradoxically feel destabilizing, triggering anxiety, irritability, even rage. Why some suffer more: genetics, receptor sensitivity, stress load, trauma history, sleep loss, and PMDD risk factors can amplify this neurosteroid GABA imbalance. The result: some people have extreme outbursts near their periods, while others have only mild PMS, reflecting different brain sensitivity to the same hormonal shifts. PMS versus PMDD. In brief, PMS involves bothersome premenstrual symptoms with preserved daily functioning, while PMDD is a severe cyclical mood disorder causing marked impairment in work, school, or relationships. American Psychiatric Association 2022, DSM-5, TR. PMDD features predominantly mood symptoms in the final week before menses, such as marked irritability or anger, mood swings, depressed mood, and anxiety, often with physical symptoms too. Symptoms improve within a few days after bleeding starts and are minimal post-menses. Crucially, they cause significant functional impairment. American Psychiatric Association 2022, DSM-5 TR. PMS and PMDD are defined by timing. Symptoms track a specific menstrual cycle phase and ease after menstruation begins. Persistent symptoms outside this window suggest another diagnosis. National Health Service 2023, PMS and PMDD Overview. Keep a daily symptom diary or app for at least 2 cycles to confirm the pattern and severity. This helps differentiate PMS from PMDD and guides care. American College of Obstetricians and Gynecologists, 2023, Premenstrual Syndrome. Treatment may include lifestyle measures, psychological therapy such as CBT, and, when indicated, medicines like SSRIs, which have established evidence for severe PMS/PMDD. Selected hormonal approaches can also be appropriate in some patients. Steiner et al. 2011, Journal of Obstetrics and Gynecology Canada. American College of Obstetricians and Gynecologists, 2023. What about extreme anger or physical violence? This requires an especially important clarification. Hormonal shifts in PMS and PMDD can fuel severe irritability, emotional dysregulation, and angry outbursts. The APA's DSM-5 TR 2022 recognizes PMDD, and ACOG 2023 notes marked premenstrual irritability in some patients. But biology never excuses violent behavior. Physical aggression often involves multiple factors. Rapkin and Weiner, 2009. Severe PMDD, coexisting depression or anxiety, trauma, chronic stress, relationship conflict, sleep loss, substance misuse, or other psychiatric and medical conditions. If extreme rage or loss of control recurs predictably before each period and eases after bleeding starts. Discuss PMDD assessment with a doctor. Keep a daily symptom diary for at least 2 cycles, and ask about evidence-based treatments. Violence is always a safety issue, whatever the cause. If you fear you might harm yourself or someone else, seek urgent help now. Call emergency services, a local crisis line such as Samaritans, or go to the nearest emergency department. Create a safety plan with a clinician. C.W. Chu 2014 Guidance on Responding to Violence. What did classical Muslim physicians contribute? According to the medical literature of the Islamic Golden Age, citing the works of renowned physicians such as Ibn Sina, Avicenna, Al-Raza, Razas, and Al-Zahrawi, Abul Qasis, Muslim physicians systematically studied menstruation, women's reproductive health, reproductive disorders, diet, diagnosis, and medical treatments. Ibn Sina discussed these subjects within Al-Qanun Efa al-Tib, the Canon of Medicine, while Al-Raz compiled extensive clinical observations, diagnoses, and treatments in Al-Hawi Efan al-Tib, the comprehensive book on medicine. Al-Zahrawi described obstetric and gynecological procedures, surgical instruments, and important clinical precautions in Al-Tasraf, demonstrating the highly developed medical and surgical knowledge of the Islamic civilization, as mentioned in the classical medical works of Ibn Sina, Al-Raza, and Al-Zahrawi. Their scholarship is a landmark in medical history, yet not every therapy they proposed is established today. Much of classical medicine drew on humoral theory, balancing qualities like heat and moisture in the body. Modern science, however, explains menstruation via hormones, prostaglandins, and conditions such as endometriosis, and relies on pharmacology and evidence-based trials unavailable to earlier physicians. This historical context is essential for a fair appraisal. A balanced Muslim approach is to honor our predecessors' scholarship, benefit from traditional remedies where safety and evidence support them, and follow stronger modern medical evidence when available. Islamic ethics encourages seeking beneficial knowledge and appropriate treatment and trusting in Allah while taking sound means. When should a woman see a doctor? Seek medical advice if you have severe or worsening period pain, pain that stops normal activities or school or work, very heavy bleeding or flooding, fainting or severe dizziness, bleeding between periods or after sex, significant pain during intercourse, new or one-sided severe pelvic pain, possible pregnancy with pain or bleeding, symptoms of anemia such as marked tiredness or shortness of breath, or persistent severe depression, anxiety, rage, or intrusive self-harm thoughts that clearly track with your cycle. Keep a symptom diary and see your GP or gynecologist for assessment. According to the Quran, citing Surat al-Baqarah, chapter 2, verse 222, menstruation, haid, is described as adha, meaning harm or discomfort. It is not described as a punishment, nor does it make a Muslim woman spiritually inferior. Allah has established clear rulings to be observed during menstruation until purification. According to Sahih Muslim, citing the narration of Aisha, may Allah be pleased with her, women were instructed to make up the obligatory fasts missed during menstruation, but were not required to make up missed prayers, as mentioned by Muslim Ibn al-Hajjaj in Sahih Muslim, Hadith 335. A Muslim woman should therefore understand both her din and her body, approaching menstruation with knowledge, dignity, and confidence. She should recognize what discomfort is typical, when symptoms warrant medical attention, how to care for emotional well-being, and when to seek help. Parents should prepare daughters before menarche. Husbands and families should understand and support. Men should never mock or dismiss symptoms. And women should not be expected to silently endure severe pain or distress that may have a treatable cause. Knowledge removes embarrassment. Compassion removes stigma. Seeking sound treatment is fully consistent with trusting Allah. Medically, current guidance supports symptom tracking, exercise, and healthy lifestyle measures for PMS, NSAIDs, and where appropriate, hormonal options for dysmenorrhea, and investigation when pain is severe or persistent. Key sources consulted include NHS guidance from 2023, ACOG publications from 2022-2023, and NICE guidance updated in 2017-2018. Professionally, for a public lecture, best practice is to have the detailed fiqh on haid, istihada, and tuhur reviewed by a qualified scholar, and the clinical content reviewed by a GP or gynecologist. This safeguards accuracy and serves the community. Disclaimer: the content in this video is intended for educational purposes only and should not be considered a substitute for professional advice. Always consult a qualified expert for guidance specific to your situation. Write where you are watching from: city, state, or country. Don't forget to like, share, and subscribe to stay connected with more inspiring content. Your support helps us reach more people and keep these important conversations alive. I'd love to hear your thoughts, questions, or personal experiences. Share them in the comments below. Your voice truly matters. Together, we can build a meaningful dialogue that benefits us all. Thank you for watching. May this video serve as a source of knowledge and reflection.